All right. Hey guys, welcome to this week's episode of Healthspan Academy. Today's guest is somebody who I've known for several years. I've had the pleasure with working with on a bi-weekly basis. He's part of my personal arsenal of health and wellness professionals, predominantly because of his unique proactive outlook on health, wellness, and longevity. Dr. Dan Vitale, he studied his at York University, specialized honors in kinesiology, health science. He's a doctor of chiropractic, and he got that from Canadian Memorial Chiropractic College. He studied various soft tissue techniques, including the Graston technique, the active release technique, and he has a certified certificate from the Acupuncture Foundation of Canada Institute. He's completed his Webster Certificate of Personal Care course with the International Chiropractic Pediatric Association. Dr. Dan is also trained in functional range conditioning provider. Dr. Dan believes in natural, hands-on, drug-free, and prevention-focused approach to chiropractic. He has also completed Lake Placid and Mont Tremblant Ironman, as well as several other running distance races. Dr. Dan, welcome to the show. It's a pleasure to have you and chat with you today.
Thanks, guys. Great to chat with you today as well.
Right off the bat, what don't you do? Long list of credentials. I've worked with you over many years. We've known each other, and one of the exciting things about today is that we get to talk about things that we're both very passionate about. We're going to kind of try and keep the focus around your chiropractic clinic, give patients or people a little bit of a sense of what you do, your approach to chiropractic treatments, and basically your proactive and your long-term outlook. So getting going, first question, really just explain to the listener, your unique approach to health and wellness, and then we'll go from there.
So my unique approach would include everything that it has to do with the human body and trying to stay healthy and well for as long as possible. And that concept of health span versus lifespan is something that's probably one of the main focuses now, especially as I have a larger family with 5 kids, and I want to keep up with them for as long as possible. And so some of the goals, I'm kind of reverse engineering life for myself, and a lot of that stuff is what I share every day with my patients and with my families that I see, learning a lot of the mismatch between what we were designed to be doing, this kind of evolutionary biology approach and ancestral health, where we look at what our body was designed to do over thousands and thousands of years versus what we're currently doing, and trying to see if we can kind of connect the dots and get back to some basics and stay healthy. And that's where a lot of these concepts of prevention and biohacking, if you will, that's where a lot of this stuff comes in. And so I incorporate a lot of that into my practice. I can talk a little further as to how I practice as a chiropractor. I focus primarily on the spine initially, making sure that, and the main reason we do that is because of the central role of the brain. That's kind of the computer of the body that controls and coordinates everything. So it's protected by the skull, and then it sends a signal down that spinal cord to communicate with your whole body. So that spinal cord is protected by these 24 little vertebrae, the bones that we call the spine. And if they're aligned in a proper position, and if they're moving in a proper position, the spine functions well. So I have special emphasis on the spine because of my training as a chiropractor, but then I look at pretty much every joint in the body. And I have the ability to, with some of the skills that I've learned, dealing with pain, discomfort, and limitations in those joints. And motion is lotion. That's kind of the cheesy phrase that I use, but I apply that to every part of the body. And through education, I think educating people is probably right there beside the care that I provide, and teaching people different things that they could do every day, from little things to add every single day. And I always say, instead of trying to hit a home run, just add singles every day, and you're going to do way better in the end. And I'll kind of leave it there. If you want to kind of target, I'll focus on that.
Yeah, absolutely. Branching off of that, I know a lot of people that talk about chiropractic, their chiropractic experience or treatment, a lot of people go in with a lot of misconceptions of what actually happens. I know you and I have worked together, and specifically like pre and post chiropractic visits. I know there's a lot of specific things that should be done. I know you talk about the alignment process, and kind of once I'm done seeing you, that alignment, doesn't really last very long without the proper post exercises, and just kind of, inform people on that if you will.
Sure. So the spine is kind of load bearing. Gravity's kind of pushing on our heads. If you drop something, it'll fall pretty much any time. So that spine has to kind of bear all this load. So the spine, the way it's designed from the front, it should be nice and straight. You shouldn't see any kind of lateral or shifting curves, but although I do see that, those are often what we call scoliosis. And then we have specific things we target. So the end result is if you have this lateral curve in that area, gravity's pushing down and you're putting undue stress in a certain part of the spine, and that spine can potentially break down earlier than it should. And then from the side view, you want to see three curves. The most important curve I always emphasize is the one in the neck because of the proximity to the brain. So the spinal cord is kind of like the 401. It has to send the signal down the spine, and it has to send the signal up as well. And all that information that gets to, for example, your big toe has to get through your neck area. So we put a lot of emphasis on the neck. A lot of modern life has affected our forward head position, and people are kind of stuck in this forward head position. And we know a forward head posture and losing that nice curve in the neck makes you more susceptible to damage in the spine and to the disc, and eventually pinching nerves and causing, numbness and tingling. So
Right.
the big thing that we focus on for sure is posture. So before somebody comes in for an adjustment, I usually tell them, if they can, is to go for a walk, get that spine moving. Now that I'm trained in kind of FRC, I start teaching full body kind of range of motion, if you will, morning routine that I call morning check-in, where you get to move the whole body even for 5-10 minutes in the morning. That would be ideal, so that you're nice and supple before I have you on the table, before I start moving the spine. And then we want to make sure that we target the specific areas that we've assessed on you. I usually have a little check-in where I see how your activity's been, how that affects parts of your body, because I see a lot of people that are quite active based on my encouraging them, all the time. So I always want to check in if anything's kind of bugging them that day, if you will. And then we often go back to some of the previous, slips and falls and bumps and sports injuries and sleep positions that have affected you, that individual on the table. And then after that, we usually have some targeted movements that we specifically give to the individual based on what they've presented with. And that could be something like, mobilization, using a lacrosse ball, targeted eccentric exercises for rehabbing. And again, a lot of the movement is the key for kind of everything. And then that comes into a lot of what we assess, which is the range of motion of the tissue. And based on injuries, everybody has their limitations, but we try to work with that individual and try to optimize that. So trying to reintegrate the adjustment through a nice walk after is important. If you're going to exercise, often after is well a good time to exercise, because you're in a good alignment, your neurology is working well, and your muscles optimally are firing at a good way as well. And that's what we encourage.
Yeah, that's something I really appreciate about seeing you, is the teaching, the coaching. Like it's not just a 5 or 10 minute session of having that spinal alignment. It really does come home with me. I know you take a lot of notes, and then you provide a lot of follow-up emails with information, videos, exercises. You make it very practical and implementable in my life, and I'm sure the other people appreciate that as well. Maybe just one more question for me, and I'll hand over the reins to Craig. I really want to talk about like most common issues. I don't want to generalize. I know sitting is probably up there. Maybe just talk about the issues with sitting, and just like kind of the small changes, because people think, oh, well, I have to sit, or I can't stand, because standing just like, if I stand for 12-hour shift, I can't do it anymore. So, my understanding is it's the change in movement. It's not just standing or just sitting, or, just kind of talk about that if you don't mind, and tell us what we can do.
Sure. This concept of sitting as a new smoking has been out for quite a while. There's been several books kind of educating. Kelly Starr wrote a book called Deathbound that's pretty neat too, where it goes through some of these issues. Looking at kids that are sitting, and when we're looking, I think squatting is one of the most important things that a human should be able to do, and we start losing that squat essentially by the time we're in grade 1, because we're sitting in this 90-90, which is a fairly artificial position from an evolutionary biology standpoint, where we're kind of stuck, and we get shortened in our hammies and in our calves, and low back muscle tightness, hip flexor tightness. All these things happen, and they're usually a big link of what you can do to avoid that is working to stretch that tissue passively when you're in a standing position. So standing, I have to make this emphasis as well. When we go from a sit to stand position, that's not necessarily the solution to stand, but you're way more likely, you have the inertia to move. So you're more likely to go to the bathroom. You're more likely, I'm big on nutrition, exercise snacks, I call them, where like right now I just got a 60-pound kettlebell and it's in my private room.
Me too.
In between patients, I'll hop in there and I'll do, anywhere between 1 and 5 to 10, swings, KB swings, and pull up bar, outside of your office, so having this ability to move your body is what is important. On a more realistic, for the average person, just standing up and doing like a lunge position, having a stool, or I recommend the stool that goes up and down and maybe has a bit of an oscillation in it that allows you to move that spine, because that's one of the most important things that I emphasize is that movement in the spine. That's how we get nutrition into the discs as well. Coming back to the spine just briefly, we can replace hips and knees. Currently, we're not doing a whole lot of spine replacement, so we want to keep that spine movement of the spine, just like any other tissue or joint in the body, is one of the most important things to keep it supple. And from a longevity standpoint, that's where we want to maintain it. But when we sit to stand, is important that you can do a little bit of everything. If you can squat, get into a deep squat position, or alternate these positions, or take advantage of different stretches. These are things that we can do as well. I often give like a TheraBand that you can do, kind of banded chin tucks to break the monotony of this forward head position. These are all different little exercises. So pretty much you want to create a movement-rich environment around your workstation. And now with the reality that more and more people are working at home, this is the thing that would be important when somebody's still, how far along we are in this process where we're at home, that people are still sitting at their dining room table, hammering away on a keyboard, on a tiny laptop, or on their handheld device. That's going to cause a lot of the issues that we see with this forward head position, which you asked me earlier, the most common things are neck pain, headaches, numbness and tingling in the hands, wrist pain because of using these devices. Low back pain is for sure right up there. So a lot of this can be mitigated with just simply more movement. I mean, just going for a walk throughout your day and having these brief sessions of walking and moving is key.
Yeah, small changes, right? Like small practical 1% changes. I know my house is a bit of a mess with exercise equipment and rubber bands. Like just having one rubber band in your arsenal of exercise equipment, and especially for standing and doing pull-up arts and stretches, and then I've got the toe spacers in with the lacrosse ball under my foot, and it's just it's movement, like you say. My normal job of being a pilot involves a lot of sitting, but I need to offset that, and there's just where there's a will, there's a way, right? So
absolutely.
Awesome. Greg, over to you.
Yeah, so I wanted to dive into the topic of you kind of alluded to this, and I think when the challenge as a practitioner, I think it's similar to what you see as a coach, is meeting your patients and clients where they're at. And I just know in my own experience, my perspective around therapy has evolved over the years. And in the sense that I think the deeper you go into, your own body and your own research, and you closer you get to being kind of the CEO of your body and your health, and that the people that you see become this advisory committee. So that's kind of how I've really valued treatment I've gotten from you, is that, you have a good sense of where people are at and what kind of resources they need next. So I want to dive into that a little bit. The challenge, because I think the mindset, the kind of social norms around healthcare in general, is that they just want to throw you the reins and expect you to fix all their problems, and they don't want to take a lot of that ownership. It's kind of the same with coaching, right? people are going to, if they're doing something crazy outside of the gym, they're still going to hurt themselves. Or it's same with chiropractic. So there's kind of like, you have to get people to buy into that. So I want to talk about the art of meeting people where they're at and helping them get to that next level. How does your mindset change from one person to the next? And how do you sort of mitigate that when you see a wide range throughout the day?
So on initial meeting with the patient, now we do an online form, and now I think it's about 9 pages long. So it is extensive and it's probably tedious, but at least when I'm reading that before I meet the person, I can start conceptualizing what I'm going to expect. And I already have a bit of a game plan to kind of get going with that patient. Videos that I know that they're going to benefit from, content that I've reviewed. I have like a lending library of books that I often will give out, and already I'm starting to plan. And then when I meet them, I talk again about this lifespan, health span discussion. Very few people want to live long. They often want to live healthy long. When you tell them, how about living to 100? And they're like, eesh, I'd never want to live to 100. But what if you live, as you are now when you're 100 years old? And then that candle kind of just burns out, and that's you've had a great life. So I already start that conversation, and then we talk about some of the things that they can be doing differently based on where they are now. I'm very realistic. I often will look at the spine as well, and we're realistic in saying, some of the damage that's in there, some of that is not reversible. So we're going to work within what we have. The amazing thing is that our body has this incredible ability to heal and regenerate tissue, as long as the imposed demands are specific. So if you're working the tissue, but some of it is heavy lifting. And I always say, if you come to me and you kind of pass me your body and say, here, fix me, I call that a very passive, low level of healthcare for anybody. But if we're going to work actively, that means, I'm going to probably do some heavy lifting in the beginning, but then after, as I see you less and less over time, you're going to start taking a more active role, of course, if you choose to. And this lends into a lot of discussions where I give patients the option. I say, listen, we can do this, and it's going to take some work and effort, or we can do this, and it's a lot easier. And that's usually a discussion about, for example, orthotics and wearing toe spacers and lacrosse ball on the feet, so you can choose one option or you can choose the other. Some people usually within the first honeymoon stage of care, they're all in. And then as time fades, they start moving away. So it's up to me as a chiropractor and as a coach as well, as a health coach with them, is to just remind them what their goals were when they started and bring them back. And also to remind them how far they've come and how great they've done, and, give them a pat on the back. And sometimes a kick in the pants. So it depends on what's happening with that. But that's usually my approach to try to meet people where they're at. And I see, based on the type of care I've provided in the training, I pretty much see people from the beginning of, I'll see pregnant moms with some of the training that I've done, to all the way to the newborns, so to the end of care. So of course, doing these different things, and there's different reasons, because I've had a family, and then I got more interested in kids because I had kids, and then I said I should get some more training in this area. So I started training. And then, as you know me, I like to dive deep into that rabbit hole. And then every once in a while, my wife kind of pulls my head out and reminds me this is what the rest of the world is doing. So, again, it's a passion for learning and for helping and educating. I think helps you provide that individualized approach, because you can't just do the same old for everybody and hope that it works,
For sure.
Absolutely.
Yeah, I think like you can totally lose people. And I think like you kind of alluded to talking to Cynthia, and it's, I kind of have the same dynamic with Made. It's like that yin yang. If you're pushing too deep down a hole, they kind of like remind you of where the social norms are at. So we're not going too mad scientist on people. But I think that's like what really sets you apart as a therapist. I've kind of done the rounds of like seeing tons of physios and chiros over the years, and we've developed a good relationship. And I think that's what you've truly mastered, is that where to lead people and how to lead them. And I think that's been, that's a big part of why you've done well for yourself. So cool.
One other point I just want to say, I think I am the first to admit that I don't have it all figured out as well. As much of the training, and I think we all have limitations. I think it's super important to work with a team. I think we all look at the human body and through our psychology and our experiences and our beliefs, philosophies. I think we look at everything a little differently. So I think if you go see somebody and they think they have it figured out, I would encourage you to turn around and go the other way, because I think it's important. And kind of what you alluded to earlier, I think the more we learn, the more we realize how little we actually know. When you think you got it all figured out, I think nutrition is probably one of the top ones. I've dived deep into nutrition and supplementation, and it's a can of worms for sure. And yeah, so it's this passion for learning too that I think that we share, that is important to keep you going. But I think it's pretty humbling every day when you realize, geez, even coming on today, I was like, you're kind of reviewing some of the stuff, and you're thinking, just like writing books as well. By the time you're writing, you're kind of like, oh, there's so much more I want to put in there, and
Yeah,
I want to read this, but you got to realize that we all have those limitations. So that's important.
That brings up that other point of that 1%, right? Like, don't try and do 100%. Try and do 1% perfectly daily, and then that'll compound, right? Like, it's just the power of compound interest. Everybody can relate to that, but when you look at a large scale and you want to be able to lift 200 pounds in a month, well, is that realistic or unrealistic? Or should you get really good at lifting 100 pounds every day and then build your way up? And results might be a little bit longer when it comes to health and longevity, but I'm sure you can relate to all the kind of the short term, I guess, results that you can measure and we can see, but it's that long-term mentality and not getting stuck going down certain rabbit holes, and the people that balance us in our life, and the team members that we end up accumulating. And yeah, it's all good stuff.
For sure.
Awesome.
I want to segue a little bit into, you kind of alluded to this a little bit, and obviously the cervical spine being closest to the brain's obviously the master sort of dictator of what's going on in the body. How important is your mindset before you get into chiropractic? Like, because the mind just creates so much stress in and around the body, and especially like we're in a pandemic right now. People are just generally a little higher stress than normal. Is that change what you see clinically and how you treat people? Like, just easing into their stress? Do you notice there's more tension and traps in those stress muscle areas now? Like, how do you mitigate that, and what's your strategy in tackling that?
That's great question. That's super deep. I don't know how far I want to go, but personally, I start with a morning routine. As you know, I sauna pretty much every morning, and then I get to do a little bit of gratitude. And I've gotten into some fiction reading through recommendations from coaches as well, because this is probably, I didn't do that for 15 years or 14 years after school, probably. And then I'm actually enjoying it. So I spent probably about 20 minutes doing that. But I used to put a list of things that I wanted to get done for that day and kind of mindset. And now I try to stick to one or two. I read the 5 a.m. Club, and it kind of gave me a little bit of Robin Sharma. It was an interesting one, but you kind of break up that morning into little chunks of activity, little chunks of journaling, little chunks of gratitude, prayer, if you will. And then mobilizations in there for me too, during that morning routine. So that's how I get my head on straight in the mornings. I have a busy household as well. I usually tell patients this is my downtime when I'm seeing patients, because what happens, I work in a home office, of course. So what happens on the other side of these walls is usually, I consider, much busier, and I have to be on there as well. So I think having that partition time for myself allows me to get my head straight so that I'm ready for the day. Definitely see a ton of stress related. So the fight or flight, if most people are familiar with, we have the sympathetic nervous system, which is the fight or flight. That's like a car's going to hit you, you're drinking water and a tiger kind of comes up to you by a pond. Heart rate goes up, blood pressure, everything goes up. But often, just like if somebody's going to strike you, you go into this kind of fetal position. That's a very protective position. So often you will see me, I say I individualize care, but a trap release, working on somebody's traps, getting them to hike their shoulders. And because of forward head position and this kind of protective position, this is what I see more and more. And I would definitely agree that people are, I would say, struggling right now. There's a lot of people struggling, and we certainly do not disconnect the mind from body and how that portrays itself, but understanding how that fight or flight works is pretty important. So I'm big on recommending meditation in that morning routine, doing some breathing, simple stuff where you don't have to get into like the woohoo. For some people, feels like it's a little bit too out there for them, but just simply box breathing, doing a 4-second in, out count. A book that I've recently read and shared with many people is Breathe, James Nestor. So some mouth taping and doing some things that are going to definitely get the body into the parasympathetic, which is rest, digest, and heal. And that's kind of where we want to spend most of our time. So turning those notifications off your phone, not jamming blue light into your eyeballs first thing or all night long when you're staring at your phone before you go to bed. Just trying to calm down that body, maybe shutting off the news for a period of time. I remember one of my early coaches recommended that I only review the news maybe once a week, review my email once a day. And these are all some habits that I've definitely implemented. You go off, but you find your true north and you kind of get back to it with everything in life. But unfortunately, what's going on in the world right now, a lot of people are having, and including kids, I feel my heart goes out to a lot of the kids that are anxious to, play with friends and stuff based on what we're doing. They're anxious to go to the playground. These are things that are concerning. So teaching these strategies from the earliest age, I think, is super important for people. I mean, some of the tools that I'm learning now, my kids are probably sick of hearing half of the stuff that I kind of go up, but I wish I had some of these tools earlier on in life to deal with some mental, emotional stresses that we've all gone through, so having a little toolkit for stress is important. Having ways to identify cues that you're going, or somebody else in your life that can identify, and then getting into a routine of kind of relaxing that body and figuring out what works for you. So I really enjoy a sauna. I enjoy the heat. Some people don't like the heat. They find it very uncomfortable. It is uncomfortable, but I actually find it very relieving and very stress reducing. Meditation for me has always personally been a challenge. I've done every app known to man. I do a year subscription of a different one all the time. I'm on 10% happier right now. So I'm in and out on those, but at least I implement as I can. And then I encourage people to do that. But simply getting into your breath, I think, is something that's an easy, when you ask about a 1%, learn how to box breathe. And every time you feel like, my son punches my daughter in the face and I have to not react, that's when I do like a very short box breathe, maybe a 2-second in, but anyways, we're seeing a ton of physical stuff associated with mental. And that's, luckily now we're not downplaying a lot of the mental issues that we're dealing with. And hopefully we're going to provide lots of resources for what's to come, because I think there's a lot coming.
For sure. Yeah. I can absolutely attest to the power of breath. And I think when I first got into meditation, that was the main focus of meditation, is that it's just breathing. And but there's different facets of meditation. And then there's also like breath work in its own box. And I find like there's so much power you can do. There's like the Wim Hof method, and actually Jesse Coomer wrote a book, A Practical Guide to Breath Work, which is incredible. Cool. There's like guided sessions, and it's a game changer. It's amazing how much you can change your physiology just from how you breathe.
Yeah.
So I agree. That's some solid advice there.
I do a bunch of humming before bedtime now, just to really stimulate that vagus nerve. And it, honestly, I think it really makes a difference. Not only does it help me, like with the meditation, I would meditate at nighttime. And I found like lots of distractions, pulling myself back, and really trying to practice that. But the humming, I find the noise distracts me. So that keeps, like, in a good way. So it keeps my mind from wandering. And then just the relaxation afterwards, and tingling, and it is amazing stuff. I was not a big believer in it until I started measuring my heart rate variability, and understanding what recovery was, and understanding that I was chronically, stressed, body, physically wise. Even though mentally I didn't think I was that stressed, it's my body was under an immense amount of stress. And just a lot of the stuff you alluded to implemented in my life, and with due process and time, definitely a lot better now. But
it's a good way to trick yourself into keeping your mouth closed too, to force that nasal breathing when you can't hum with your mouth open. So it's get that nasal breath going, get that parasympathetic system jump started. Cool. I want to segue into your own personal habits, Dan. I know you've got a sort of a wide spectrum of your personal fitness habits, your personal health habits, and all these hacks and mobility work and all those pieces. And it's kind of easy, I think, to get lost when people are, but it's also like, we also need to do a little bit of everything. And, we're all dealing with more stress. How has that left your priorities? So what is your main focus right now in terms of, like, if you pick like strength or conditioning or mobility, what is number one on your list to sort of optimize right now? And what do your habits look like around that?
Wow. Number one, so I have 7-month-old twins. So I have an Oura ring that does not lie to me. I have a love-hate relationship with it because of my, as you can imagine, sleep challenges. So sleep is a big priority, going to bed earlier than ever because we know that we're going to be up at night. I think that's a big one. But yeah, sometimes I do an overhead view and I have a look at what I want to focus on. So I want to lift heavy stuff, basically 2 to 4 days a week. I'm into the zone 1, zone 2 training. As you know, I've been kind of focused on getting away from the chronic cardio with all those years of Ironman training and all the long distance running I've done. I'm totally away from all of that. So I don't have the time, but I don't think it's the best for you either. I think so now going a lot longer, slower, I think is better for me for the longevity lifespan part, for, fuel partitioning, blood sugar regulation, all these other reasons as well. So lifting heavy and then keeping, if I want to have joints, I got to move them. If you want to have so if you want hips, you got to move the hips, how the hips should move. So focusing on some big, I know we're just on having some training with others in the past. I know where most of my limitations are and other providers that I've seen. So I kind of focus and target on those ones. So if I was pressed for time, I would focus on mobility, specifically on those areas that I know I have some personal issues with. So those are the biggies. I think that morning routine, carving out time for yourself so that you can kind of envision the best day ever that day, having some gratitude, waking up with gratitude, and then lifting heavy stuff. I also intermittent fast every other day. I don't do that every day. I eat pretty solid, like 3-4 meals on my off days, if you will, and then I do one meal usually on my every other day. So intermittent fasting is something I've done for over probably 10 years now. I know I've had some special interest in the keto diet for endurance training too, because I was sick of eating all the sugar, and getting fat adapted was pretty key. So yeah, focusing on eating well, moving well, sleeping as well as I can given my circumstances, and moving my body, and my ancestral kind of evolutionary lens, looking at what we were designed to do versus kind of what I'm doing and trying to incorporate that as much as possible, being barefoot, squatting, and doing these things as well.
Awesome. Yeah, those are solid habits. Just to wrap things up, I want to talk about, you mentioned the book on breath. That could be your example, but what's been the most impactful reference or book, even the fiction stuff? What's been the most memorable for you since the pandemic hit for you? Something you can recommend as a read for the listeners?
This James Nestor Breathe has been a good one. I probably gifted that one a few times. Ben Greenfield's Boundless, I think I've gifted that one a few times as well. It's a good, for people that like Tim Ferriss, it's probably like the updated version, I say, of the 4-Hour Body. And then I'm just reading a book on gut health, a naturopath that I work closely with, Beyond Digestion.
Just got that one in the mail.
Yeah, I'm 2 chapters in last night.
Say it again.
I'm on my 3rd chapter as of last night. I got the book in the mail last night.
That's
hilarious. I think gut health is super. don't even want to go there, I think, but
oh yeah.
So yeah, some of the fiction. I'm reading a series on a Quebec inspector, and I've kind of blasted through all these books. So that's been kind of my leisure reading to try to get my brain nice and distracted in the mornings too. But yeah, that's been most of it. Most of my recent reading, I've been as you know, I don't even want to get into the podcast, but Peter Attia is one of my favorite, the Drive podcast, where I keep up on some longevity Healthspan, and there's a whole series of those that I do when I'm doing my tasks. The other thing I wanted to mention is a lot of the stuff that I may have considered outsourcing in the future, like a lot of gardening, and I laid like 5 skids of sod this weekend, and stuff that I will do now, and be willing to do, and a lot of the home stuff that we actually do, because that low level activity all day long, usually that is some sedentary time that I would probably not be doing that. So just actually jumping in and doing some of the stuff, and with the family, including everybody, so that we're all involved.
Awesome. How did I know we'd somehow end up all reading the same book if I asked you about your references? Yeah. That's hilarious. Well, I appreciate your time today, Dan. How can people reach you if they want to learn more, if they want to book in for chiropractic? What's the best way to reach you?
On the web, Guelph Natural Health, guelphnaturalhealth.ca. I think you can get all my info there. Fortunately or unfortunately, I'm not very active on social media. That's another can of worms that I'm not going to get into, but time is a luxury. I think that's one of the most important things that we have. So I don't want to often get stuck there. So yeah, on the website, you'll see a lot of my videos and a lot of educations on there too. So you can contact info's in there as well.
Awesome. Yeah, we'll put a link to your website in the show notes. Well, I appreciate the time, Dan. Hopefully we'll get you in again when the world's in a little better place somewhere down the road.
I'm sure there'll be a few more episodes with Mr. Dan.
Absolutely.
Yeah, that'd be great. That was fun, guys. Thanks.
Much appreciated.
Thanks for your time.
Absolutely.
Until next time.
Thanks for tuning in, guys, and we'll see you next time on Healthspan Academy.